Sarah, can I ask you something? You've been lying on the couch a lot lately. You used to come home full of energy, cooking, chatting, planning things. Now you barely want to move. Are you okay?
I don't know, Mike. I'm just tired, not normal tired. It feels like my whole body is heavy.
I've noticed. Even on weekends, you prefer to rest instead of going out. And you've been losing weight without trying. That's not like you.
Yeah? My clothes feel loose, but I'm not dieting. I actually feel like I have no appetite most days.
And your hands, look at your knuckles. They look darker. Did you get a tan?
No, I haven't been in the sun. I don't know why they look like that.
And you've been craving salty snacks all the time. You never used to eat that stuff.
It's weird. Sometimes I feel dizzy when I stand up. Like the room shifts for a second.
Sarah, listen. You've changed from the most energetic person I know to someone who's always exhausted. I'm worried.
Me too. I just thought it was stress.
Maybe. But I think we should get some routine tests done, just to be sure everything is okay.
Yeah, maybe you're right. Let's do that.
Good morning, Sarah. Tell me what brought you in today.
Doctor, I've been feeling tired for months. Not normal tired. It feels like my whole body is heavy.
I see. Has anything else changed?
Yes, I've been losing weight without trying. My appetite is low, and sometimes I feel dizzy when I stand up.
Any changes in your skin?
Actually, yes. My husband noticed my knuckles look darker. And I feel like my face is getting darker too, even though I avoid the sun.
Any cravings?
Salt? I never used to crave salty food, but now I do.
All right, Sarah. You've mentioned fatigue, weight loss, dizziness, darkening of the skin, and salt craving. Let's do a quick physical examination. Sarah, you look slightly dehydrated. Your weight is lower than expected for your height. Your BP is a bit low, especially when you stand. There are dark patches on your gums. There is noticeable darkening over your knuckles. These findings match what you described. I'd like to run some tests to understand what's going on. These will help us understand your hormone levels and electrolytes.
Okay, doctor.
The doctor requested a morning cortisol test to evaluate Sarah's baseline adrenal function. If the level is low, it strongly suggests adrenal insufficiency. The doctor also requested an ACTH level, which helps confirm primary adrenal failure. A high ACTH together with low cortisol is typical in Addison's disease. Then electrolyte testing was requested to assess mineralocorticoid deficiency. Low sodium and high potassium are classic findings that support the diagnosis. Other requested tests include measuring renin and aldosterone levels to evaluate mineralocorticoid function. In Addison's disease, aldosterone is typically low while renin becomes elevated as the body tries to compensate. The doctor also requested a glucose level, since low cortisol can lead to reduced gluconeogenesis and result in hypoglycemia. Finally, autoimmune adrenal antibodies were requested when an autoimmune cause is suspected, helping confirm autoimmune adrenalitis as the underlying reason for Sarah's adrenal failure.
Once we get these results, we'll know exactly what's happening. Please go to the lab today, and we'll schedule a follow-up visit. Thank you, doctor. I'll do the tests now. Welcome back, Sarah. I have all your test results ready, and let's go through them together. Before we look at the numbers, let's recap what brought you here. Persistent fatigue, weight loss without trying, dizziness when standing, darkening of your skin, salt craving. These symptoms already pointed us toward a hormonal issue. Here are the key findings from your tests. Your morning cortisol level is very low, which means your adrenal glands are not producing enough cortisol. Your ACTH level is significantly elevated, showing that your body is trying hard to stimulate the adrenal glands, but they're not responding. Your sodium level is low and your potassium level is high, which happens when aldosterone is not being produced properly. Your glucose is slightly low because cortisol helps maintain normal blood sugar. We also found that your renin level is elevated while your aldosterone level is low, confirming that your adrenal glands are not making the hormones your body needs. These results match your symptoms perfectly. Sarah, based on your symptoms and your lab results, you have primary adrenal insufficiency, also known as Addison's disease.
So, my adrenal glands are not working properly?
Exactly. Your body isn't producing enough cortisol and aldosterone. That's why you feel tired, dizzy, crave salt, and have skin darkening. The good news is Addison's disease is treatable. You'll need hydrocortisone to replace cortisol, fludrocortisone to replace aldosterone, education on stress dose steroids during illness, a medical alert bracelet for emergencies, and regular follow-ups to adjust doses.
Will I feel better?
Absolutely. Most patients feel a big improvement once treatment starts. We'll start your treatment today. You're going to feel like yourself again.
Thank you, doctor. I'm glad you helped me.
Sarah, a 35-year-old school teacher, presented with a 6-month history of progressive fatigue, unintentional weight loss, dizziness, and increasing darkening of her skin. She reported craving salty foods and feeling lightheaded when standing. On examination, she appeared tired but alert, with notable hyperpigmentation over her knuckles and interphalangeal joints, as well as subtle darkening of her gums. Her blood pressure was low, and she showed signs of chronic volume depletion. Laboratory evaluation revealed hyponatremia, hyperkalemia, and a markedly low morning cortisol level. Her ACTH was elevated, consistent with primary adrenal insufficiency. Further testing showed low aldosterone with elevated renin, and autoimmune adrenal antibodies were detected, confirming autoimmune Addison's disease. Sarah was started on hydrocortisone replacement therapy, along with fludrocortisone for mineralocorticoid support. She received education on stress dose adjustments and the importance of lifelong therapy. With treatment, her symptoms gradually improved, her energy returned, and she regained her ability to carry out daily activities. Sarah's journey reminds us that even the quietest symptoms can tell a powerful story. And with the right care, recovery becomes not just possible, but beautifully human. Addison's disease is a rare endocrine disorder affecting roughly 100 to 140 people per million. It occurs more often in women, typically between the ages of 30 and 50. The most common cause is autoimmune adrenalitis, where the body's own immune system gradually destroys the adrenal cortex. As the adrenal glands fail, of cortisol, aldosterone, and androgens declines. The pituitary responds by increasing ACTH secretion, but the damaged glands cannot produce enough hormones. This leads to characteristic hyperpigmentation, electrolyte imbalance, and the clinical picture of adrenal insufficiency. Understanding the prevalence and pathogenesis is essential. It forms the foundation for recognizing, diagnosing, and managing this life-threatening yet treatable condition. The symptoms of Addison's disease often develop slowly, making the condition easy to overlook. One of the earliest and most common features is chronic fatigue, a deep, persistent tiredness that doesn't improve with rest. Patients may also experience unintentional weight loss, salt craving, and episodes of dizziness, especially when standing due to low blood pressure. Skin changes are another hallmark. Increased ACTH levels stimulate melanocytes, leading to hyperpigmentation, darkening of the knuckles, elbows, scars, and even the gums. This pigmentation can be subtle at first, but becomes more noticeable as the disease progresses. Gastrointestinal symptoms are frequent and often misunderstood. Patients may report nausea, vomiting, abdominal pain, or diarrhea, which can easily be mistaken for other conditions. Other systemic features include hypoglycemia, muscle weakness, and mood changes such as irritability or depression. Together, these symptoms form the clinical picture of adrenal insufficiency, a condition that requires careful recognition and timely management. Investigating Addison's disease begins with simple baseline tests. Patients often show low sodium, high potassium, low glucose, and elevated urea, all reflecting the loss of aldosterone and cortisol. These abnormalities provide the first clue that adrenal insufficiency may be present. Hormonal testing offers more precise insight. A low morning cortisol level combined with high ACTH strongly suggests primary adrenal failure. We also look for low aldosterone and high renin, which confirm mineralocorticoid deficiency. The most important diagnostic step is the ACTH stimulation test. After administering synthetic ACTH, a healthy adrenal gland should produce a clear rise in cortisol. In Addison's disease, cortisol remains low, confirming the diagnosis. Finally, autoimmune markers, such as anti-21 hydroxylase antibodies, help identify autoimmune adrenalitis, the most common cause. Imaging with CT or MRI is reserved for cases where infection, hemorrhage, or malignancy is suspected. Together, these investigations form a structured pathway, guiding clinicians from suspicion to definitive diagnosis. Treatment for Addison's disease focuses on replacing the hormones the body can no longer produce. Daily hydrocortisone provides cortisol replacement, while fludrocortisone restores mineralocorticoid balance. Doses are adjusted to mimic the body's natural rhythm, higher in the morning, lower in the evening. During illness, surgery, or trauma, patients require stress dosing, temporarily increasing hydrocortisone to prevent adrenal crisis. Every patient should carry an emergency injection kit and wear a medical alert bracelet. Education is vital. Patients must understand sick day rules, maintain adequate salt intake, and avoid dehydration. Regular follow-up ensures blood pressure, electrolytes, and symptoms remain stable. With proper hormone replacement and awareness, individuals with Addison's disease can lead healthy, active lives.